Does the cold sore virus raise Alzheimer's risk? The virus that causes many cold sores is extremely good at staying. Your immune system can suppress it. Antiviral medicine can interrupt it. But once herpes simplex virus type 1 enters the body, it can establish a lifelong latent infection in nerve cells, periodically returning like a former flatmate who still has a key and absolutely no respect for boundaries. In 2025, a large study in BMJ Open reported an unsettling association. People with an Alzheimer's diagnosis were more likely to have a recorded diagnosis of herpes simplex virus type 1 than matched controls. The adjusted odds ratio was about 1.8. That number became an eye-catching claim that the cold sore virus raises Alzheimer's risk by 80%. There is a real result here. There is also a gap large enough to drive a pharmacy delivery van through it. The researchers used a United States insurance claims database covering records from 2006 to 2021. They identified more than 344,000 people aged 50 or older with Alzheimer's disease, then matched each one with a control of the same age, sex, region, database entry year, and similar amount of healthcare use. They searched earlier records for diagnostic codes for herpes simplex virus type 1. Among the Alzheimer's group, about 1,500 people had a recorded virus diagnosis. Among the equally large control group, a little over 800 did. After adjustment for measured health conditions, the odds of a recorded herpes diagnosis were about 80% higher in the Alzheimer's cases. The association was strongest in people aged 75 or older. Notice the phrase recorded diagnosis. Herpes simplex virus type 1 is extremely common, and many infections are never captured in an insurance claim. Many people have no symptoms. Others get an occasional cold sore and never ask a doctor to immortalize it in a billing code. In this study, fewer than 1% of either group had a herpes simplex virus type 1 diagnostic code. The database was not measuring everyone who carried the virus. It was measuring who had a recognized episode that entered the medical system. That matters because people who receive a diagnosis may differ from silent carriers in symptom severity, immune health, healthcare access, and countless other ways. A diagnostic code can be a biological clue wrapped in a behavioral and administrative mystery. The 80% figure is also an odds ratio from a case control analysis, not a direct statement that any person with a cold sore has an 80% higher chance of developing Alzheimer's. The design started with people who did or did not have Alzheimer's, then looked backward through records. It found an association between the two coded diagnoses. It did not randomly infect anybody, for several obvious reasons, and it cannot establish that the virus caused the disease. The study included a second result that made the story even more tempting. Among roughly 2,300 people with a recorded virus diagnosis, about 40% had received antiherpetic medicine before any Alzheimer's diagnosis. Those treated patients had a 17% lower adjusted rate of developing Alzheimer's than diagnosed patients without recorded treatment. That sounds as if antivirals may protect the brain. They might, but people who receive treatment can differ from people who do not. They may have different symptoms, health habits, doctors, insurance coverage, or medication use. The claims data did not include viral severity, laboratory confirmation, genetics, education, lifestyle, or Alzheimer's biomarkers. An association with treatment is not the same as evidence from a randomized trial. There is also a relevant conflict to keep visible. The study was funded by Gilead Sciences, and 4 of the 5 authors reported being employees and shareholders. That does not make the data wrong. It means the funding and interests belong on the table while independent teams test the result, because transparency is part of the method, not a decorative footnote. Why suspect a link at all? Herpes simplex virus type 1 is neurotropic, meaning it is adapted to live in the nervous system. During reactivation, it can trigger inflammation. Laboratory and animal studies suggest infection can interact with processes involving amyloid beta and tau, two proteins central to Alzheimer's research. One provocative idea is that amyloid beta may partly act as an antimicrobial defense, trapping pathogens, but creating damaging deposits when the response becomes chronic or dysregulated. That mechanism is plausible enough to investigate and nowhere near settled enough to announce that a cold sore is rewiring your brain. The 2025 claim study did not scan brains, measure neural connections, or observe viral particles changing memory circuits. The word rewiring is a cinematic metaphor, not the result they measured. Later in 2025, a systematic review and meta-analysis combined 32 studies involving herpes viruses, antivirals, and dementia. Its conclusion was much less dramatic. Overall, the literature provided little consistent evidence that herpes viruses raise dementia risk. Clinical episodes of herpes simplex virus types 1 or 2 showed a modest pooled association with all-cause dementia, but that result became statistically inconclusive in a sensitivity analysis. For Alzheimer's disease specifically, the pooled estimate also crossed the line of no effect. The antiviral story was not a clean rescue either. The pooled analysis found a lower all-cause dementia rate after antiviral treatment for varicella-zoster virus, the virus behind chickenpox and shingles. But the pooled estimates for herpes simplex treatment and Alzheimer's disease were wide and statistically inconclusive. Translation: the broader review did not establish that treating cold sores prevents Alzheimer's. One striking database result had entered a room where the total evidence was still arguing. Alzheimer's disease is not likely to have one universal cause. Age, genetics, cardiovascular health, and many interacting biological processes shape risk. Infection could be one contributor in some people, a marker of another vulnerability, or an innocent passenger correlated with healthcare patterns. Reverse causality is possible too. Biological changes during the long preclinical phase of dementia might influence immunity or healthcare use before a formal diagnosis appears. So what should a person with cold sores do? First, do not panic. Having herpes simplex virus type 1 does not mean you will develop Alzheimer's. This video is not medical advice and is not a reason to start, stop, or stockpile antiviral medicine. Antivirals have specific uses, benefits, and risks. A clinician can advise on recurrent or severe outbreaks. Internet archaeology through your old lip photos cannot calculate your dementia future. Second, treat the association as a research lead, not a verdict. The useful question is whether preventing infection, reducing reactivation, or treating symptomatic episodes can change long-term brain outcomes. That question requires prospective studies and randomized trials, not only retrospective billing records. The route from insurance code to medical recommendation is long, and it contains several locked doors labeled causation. The most honest version of the story is still weird enough. A virus carried by a huge share of humanity, famous mainly for appearing on the lip before important photos, lives quietly in nerve cells. One large record study found its diagnosed episodes were more common among people with Alzheimer's, and treatment was associated with a modestly lower rate. A later review showed why those findings cannot yet be treated as a settled effect. The cold sore virus may be involved in the biology of Alzheimer's, or its medical record may be pointing towards another factor researchers have not fully captured. Either way, the ordinary blister has opened a much larger question about infection, immunity, and the aging brain. Annoying behavior from something that already arrived uninvited. If you enjoyed this strange little journey, subscribe and help us reach 1 million curious minds. There are many more weird facts hiding in plain sight, and we intend to bother all of them. The only question left is which one we bother next.